Hey, welcome to Mike at MedicareSavings.us. This happens to be some of the emails that I get, and so a lot of you guys may not know about the Office of Inspector General, OIG, as it's called. And this is specific to, if you're on Medicare, that's great. And this is something that's not on your radar so much. But if you're a provider, clinician, or, someone in the healthcare industry and have patients that are in a federal program, then this might be for you because so much fraud happens within the healthcare industry. And that's where the Office of Inspector General steps in to regulate and actually enforce some of the things that are not so good in our industry. So here's some of the, latest news. And so if you have, more interest in this, or if you have questions about certain enforcement actions being met, then this is where to go, and you can get the newsletter from HHS.gov. So here we go. And on February 25th, 2022, OIG posts 8 enforcement actions. So this is not necessarily in the news, or it could be in the news media on some media outlets, but this is where they get it. So Hamden Psychiatric Practice and its owner pays $310,000 for employing excluded individuals. I haven't read into these articles yet, so I'm just reading out the actual titles live with you. Associated Medical Director of Baltimore County, Maryland Pain Management Practice sentenced to federal prison for accepting kickbacks. Former Virginia Beach owner sentenced to multi-million-dollar healthcare fraud scheme. And Fort Dodge man sentenced to federal prison for misappropriating Social Security benefits for severely disabled nursing home residents. Obviously, if he was sentenced, that is not good, especially for him. Okay, Attorney General Moody announces arrest of nursing home employee for exploiting a disabled senior. Very, very much not a good thing. And Attorney General Bonta announces arrest in alleged Inland Empire hospice scam defrauding Medicare and Medi-Cal programs for more than $4.2 million. Yeah, they're not. OIG is definitely not going to like that, and I think the OIG has over 1,600 employees. So if you're in the medical industry and never heard of the Office of Inspector General, they look over all the claims and look at patterns and look at how people may have criminal intent behind their fraud schemes. Okay, we have Attorney General Cameron. Attorney General Cameron announces conviction of Livingston County woman for Medicaid fraud. Yep, that happens a lot as well. So Medicare and Medicaid, federal funded. So, OIG with the 1,600 strong, not a good look for this person. Former addiction clinic manager charged with 10-care fraud and drug fraud, ID theft. Man, there's so much going on. And this obviously is all bad news because OIG is literally the enforcer, or one of the enforcers of Medicare fraud in our federal programs. And they combine with the DOJ, the Department of Justice, and also, Medicare Fraud Strike Force. And so, they've actually, I think this is for last year or the year before, but defendants billed Medicare $15 billion extra tax dollars. And so there is, I don't quite know the year, how many cases are filed for the 1,750 cases for the Medicare Strike Force. But there is 3,800 defendants. and that added 15 billion. So that means the majority of, the healthcare system in the US is very, very good. But out of that 3,800 defendants, there's millions of providers out there if you don't know exactly the US healthcare system. But out of that 3,800, and I believe it was last year or the year before, I don't know which year this is talking about, is where the DOJ, at HHS, and the Office of Inspector General come together collaboratively and enforce, getting back the taxpayer dollars, and very serious about it. So just know that that's happening in the background in your Medicare. Obviously, you're looking at Medicare for quality of care if you're listening to this, and just know you have a great enforcement arms out there helping you try to keep this great national program for you, for those of you that are on Medicare or either Medicaid or another federally funded healthcare program like CHIP. So take care, guys. Let me know if you guys like this or want more information about the enforcement and stuff like that. It's interesting to me because I'm obviously in the Medicare space on the insurance side, and I have to be aware of what's coming down the pipe for my beneficiaries, especially during this time period when COVID has made everything remote, to where it allows the scammers a lot more access that they normally wouldn't have to beneficiaries and people that are vulnerable, and they've been a lot more successful in their scams and Medicare fraud schemes. So just be aware of that and take care. Let me know if you have any questions about this. Take care. Bye.